Hello, everyone. Welcome back to the Rise to Your Peak podcast. I am here today with my guest, Dr. Terri Fox, and I'm very excited about this episode. I've followed Dr. Fox for a while. I've shared a good bit of her content. Dr. Fox is coming on today to do a deep dive about mycotoxin exposure and mold exposure and the effects that it can have on the body. Thank you so much for being with us today, Dr. Fox. How are you doing?
Oh, I'm good. Thank you for having me.
Yeah, we're all very, very excited to dive into this. I feel that in recent years, stealth infections and toxic exposure have been discussed a lot more. And especially at our clinic, as we reach more and more patients, we encounter more and more disease and dysfunction, which leads to us, obviously inquisitive minds wanting to learn more, wanting to help more people. So I'm really excited about this discussion today. And what I'd like to do at first is just help our listeners learn a little bit more about you. Um, how long have you been practicing? And what kind of led you down this path of getting into stealth infections and mold exposure?
Yeah, so I've been doing this since 2001, so 24 years.
Wow,
I am an MD. I went to UC San Francisco and finished after residency. I did a board certification in integrative and holistic medicine, which was sort of always my goal going to med school. I wanted to do a more natural approach.
that's
Um,
awesome.
Yeah, and then I studied a ton of functional medicine, and then I did functional medicine for a long time, which is an awesome and fun thing to do.
Yeah,
And kind of what happened was I felt like when you use the regular functional medicine matrix or model or whatever, you can work on healing the adrenals, get them sleeping, optimizing nutrients, and heal the gut and all that stuff. And some like 15% of my patients just wouldn't budge. Like the rest would all get better with the normal stuff. And then the ones that didn't budge, no matter what I did, all turned out to have biotoxin illness, which is Lyme co-infections, mold, that sort of thing.
yeah,
So, a biotoxin is something that a living organism releases that's pathogenic or disease causing to humans.
yeah.
And so then, once you realize you get open to the world and you start, practicing and learning and playing it, then suddenly it just shows up at your door.
Everywhere. Yeah,
Yeah, yeah. And then my son got really sick with biotoxin illness with Lyme and Bartonella, and then it started when he was 8, and then it turned out to be mold was really the real reason that he got a reactivation of Lyme. So then that led me down, deep, dark down the rabbit
yeah,
hole of mold.
yeah.
And so now I've turned out to be a mold expert.
Yeah.
After all
Funny
this.
how that works out, you know?
Yeah, it is. It is. And now my practice is almost entirely mold and Lyme.
It's so funny because obviously we have very different histories. I never went to med school. I never practiced actual um, um, healthcare practice, but just in everything you mentioned in terms of, getting into functional medicine, as you get deeper into it and you have several years and you've worked with thousands of people, you start to realize that a lot of these strategies, although they're helpful, we're still treating symptoms. We're not actually getting to the root, even though we keep claiming that we're getting to the root.
They're trying.
We're trying, yeah. And there's always this discussion around stress and nervous system dysregulation and at some point I feel like I just ended up having the same deductive reasoning that you did of like it is stress, but it's not physical or psychological stress like we're thinking. We're thinking internal burdens on the immune system causing that stress, causing that nervous system dysregulation, which brought me down that same path, like you said. If only 60% of our patients are getting better, or we're only seeing the needle move towards progress so much, I'm confident in my treatments and I'm confident that they are following the plan. There's got to be something else. There's
Yeah.
got to be holding back something, holding back that nervous system, holding back that immune system. And sometimes it is, big T trauma and boundaries and stuff like that. But I think that's a little over talked about. And I feel like stealth infections aren't quite appreciated enough in terms of that stressor or burden
Mm.
causing endocrine, GI issues, autoimmune, etc. And I feel like, maybe it's just me, maybe I'm on this movement now, or maybe more people are opening up to it, but you've been obviously on this movement for a little while now through personal experience. So I just wanted to kind of, say like I resonate with everything that you've basically said in terms of your history and what led you down this path. I feel like I'm 10 to 15 years behind you going down the exact same path, which is what excited me about this podcast. And I don't know if you happen to see any of our other episodes, but we've done quite a few deep dives about Lyme with some naturopaths and other stealth infectious specialists. So this is all very exciting, intriguing information. One question I have for you before we dive in too much further, I was curious. It seems like very, very early on, you knew you wanted to practice alternative medicine and get into
Mm.
functional medicine. Why was that? Why? It seems like a lot of people kind of go through that hamster wheel of conventional medicine and then decide they want to go into functional medicine, but you just knew right away that that wasn't your path. Can you give some insight into that?
Yeah, I mean, I always just resonated with the natural approach with, I do a lot of herbal medicine. I have a big herbal medicine background. And I went back to med school. No, I didn't go straight through. I went back at like 26. So I knew I wanted to do a more natural approach. I really probably would have rather gone to naturopathic school. Um, and I felt that if I could do med school, I could integrate the rest of it and learn and learn and learn. But if I went a different route, I couldn't necessarily integrate the Western medicine parts. Now, in some states, naturopaths can do everything, but I'm in Colorado and they can't do as much. And so I figured if I could get through the training, then it would be easier to integrate all the rest and to have the medical background be a bit more powerful.
Absolutely. You have the biggest reach now because you have endless tools in your toolbox of how you can help individual patients. So it's incredible that you saw that you had the foresight for that, early on that
Some good
you knew
mentors.
you couldn't completely negate conventional medicine. There's a
Right.
time and a place to leverage prescription medications and conventional medicine. And so to not completely negate that, but know when to leverage which approach.
Yeah, and also to have enough training to know like
Yeah.
what's worrisome and like not just assume it's mold and Lyme too. I mean, now people come to me, they've seen 40 doctors, they've done all the scans, they've gone to Mayo, so I don't generally have to do the background work. But
Yeah, of
but he's having chest pain or whatever it is, you want to feel comfortable that you know what you're doing, kind of. So
course.
it's nice,
Yeah, of
yeah.
course. So let's talk more about modern day treatments in your practice. Um, why don't you give us some insight into, so we already kind of talked a little bit about, biotoxin exposure being kind of a big driver of the dysfunction that we're seeing in society these days. Can you chime into that a little bit in terms of like what are some of the most common symptoms or side effects we see correlated with these types of stealth infections, and we'll kind of go from there.
Yeah, sure. Just in the first thing you said earlier, I was like, oh, I could talk about 10 different things. Um, so you were asking more signs and symptoms. So mold toxicity, the common signs and symptoms are fatigue, cognitive dysfunction of all kinds, um, often headaches, migraines, insomnia, anxiety, sometimes depression. And then a lot of unusual neurological presentations that don't fit into a neurological diagnosis. So like asymmetrical numbness, tingling, weakness, ice pick sensations, burning sensations, crawling sensations, balance issues, visual changes. And then there's a rapid weight gain and weight loss that's unexplainable. That's a big tip off in clinic. And then sometimes hair loss, sometimes frequency of urination, a lot of rashy stuff, kind of fungal overgrowth stuff.
Yeah.
Yeah, that's kind of the common stuff. And then you see, a lot. So if there's underlying Lyme disease, then, you might see all of that, but also with fatigue, or sorry, with joint pain and
Yeah.
achiness and flu-like symptoms
Yeah.
and that sort of thing. And then, one of the co-infections in Lyme is called
Yeah.
Bartonella. And the Bartonella symptoms look a lot like the mold symptoms, are very similar symptomatology. So sometimes those have to be teased out.
Yeah, well, and sometimes they have everything. It's like it's interesting how hosts attract
Mhm.
viruses and infections. And I had this discussion with a naturopath colleague of mine where once you develop something like chronic Lyme, your immune system is so compromised you can't detox and clear mold or EBV or other co-infections, and you also can't fix the GI pathogens that have developed. So you're in this vicious cycle of reactive immune system, inflammation, reactive nervous system, and they all kind of keep each other going. And if you don't address all, it's kind of hard to clear any of them, from what I've seen. Have you seen that as well?
So the way I look at it is that, mold is a complete attack on the immune system. So in the presence of mold, Lyme will become opportunistic and reactivate. So many people have exposure to Lyme. If you did a good, Western blot or not Quest or LabCorp, but I
Right.
did, or another one on a random sampling of the Northeast, my guess is some 90% of people have antibodies. Their body has seen Borrelia, they form antibodies to it, and less than 10% of them are chronically ill. So then I look at the why and what had to take you down, and we now know there's a good 5 treatable reasons that will allow Lyme to remain chronic in the system and active. Um, and so for me, and Lyme suppresses the immune systems. It suppresses our immune systems, the signaling pathways, and then it increases all our inflammatory pathways. And so Lyme itself can be sort of the immunosuppressive thing that allows the viruses and the other things to become opportunistic. But also mold can be that. And yeah, I feel like there's 20 things I could say here. But
Yeah.
so for me in the mold Lyme world, mold trumps Lyme. So mold is often the reason why the Lyme is active or reactivated and opportunistic. Because I find a lot of people, I mean, I don't see a lot of acute Lyme here in Colorado. It's
Mhm.
mostly chronic. And so it's more like maybe somebody grew up in the woods in the East Coast or wherever, and then, they're, total body burden.
Yeah.
Yeah, so their bucket fills and then
Absolutely.
they get in a moldy place and then the bucket, and
Overflowing.
I'll walk through that. But yes, it
Yeah.
overflows. When the bucket overflows, the system crashes and
Yeah.
the patient gets, really symptomatic.
Yeah.
But for many patients, if you treat the mold, the Lyme goes back into dormancy and that's it. Which is
Yeah.
which is amazing because I really feel mold is not that hard to treat. There's not any herxing. I mean, in a good mold protocol, you should feel nothing or better the whole time. You shouldn't be herxing and feeling worse and suffering.
Yeah.
Um, and then, so total body burden is the concept of we're born with an internal bucket and it gets full over your lifetime. So
Yeah.
plastics, pesticides, and glyphosate, and maybe there's heavy metals in there. Maybe there's
Yes.
fake protein and inflammation from COVID, and then some other environmental toxins, some biotoxin from Lyme and co-infections. And then you live in a moldy house and the bucket overflows and the system crashes. And the nice thing about that concept is that you can really pick any of those things in the bucket and work on them.
Chip
And if
away at
you
it.
get that level down below the surface again, the person can kind of
Yeah.
breathe and have bandwidth for other exposures in the world.
Yeah.
And so yeah, for me, mold is one of the easy. I mean, it's not easy if you're still in a moldy place and you have to
Sure, sure. Yeah, obviously.
get a new, yeah,
Um,
that part's not that fun at all. But the actual
yeah,
treating and the turnaround, it's a great diagnosis with a great turnaround.
yeah. It's so interesting. I love everything you said, and I mirror a lot of what you just said to every patient I speak to.
Uh,
So it's gonna be funny if patients hear this podcast, they're gonna be like, wow, they
she
talk
said
about
what
the
you
same
said.
thing. And just so everyone knows, Dr. Fox and I have never really communicated before. So the concept of an overflowing stress bucket is completely just organic, that we both use that same analogy and
Yeah.
terminology and
Oh, that's
visualization.
great.
But it's so true. The body's keeping score over time.
Yeah, and patients, I feel like they can kind of relate to that, because
Yeah.
it gets so muddled with the inflammation and the toxins and the bugs and that, it's hard to sort of grasp.
What I always tell patients, we're not looking for perfection, we're looking for progress. No one's stress bucket is going to be zero in 2025.
Yeah.
We're just trying to go from 130 to 60. We're trying to get you
Yeah.
down to 60% bucket,
And
and
the
then you
more
can
we can
thrive.
empty it, yeah, the more bandwidth you've got to go
Yeah.
stay in a moldy Airbnb on vacation or whatever. Because, mold is out there and, there's toxins and there's COVID and
Yeah.
it's all out there.
You
Yeah.
mentioned some very interesting neurological symptoms someone can have.
Mm.
Do you include epilepsy in what you've seen with mold? I've
Yeah.
encountered quite a few cases of epilepsy that were mold.
Yep. Yep. Quite a bit of seizure activity.
Yes.
A lot of like fasciculations or like those muscle twitches, but all
Yes.
over and all the time. I see that kind of stuff a lot. Like
Yes.
stuff that they've been to two neurologists and they've gone, I don't know what's wrong with you. Or hopefully
Right.
they said, I don't know, and they didn't say nothing is wrong with you.
Right. It's in your head.
It's in your head. It's always a
Yeah.
lovely
Yeah.
thing to say to someone.
Um, in your treatments, how much discussion or strategization goes into gut health and nervous system regulation or support as you go through that treatment for mold.
Yeah. So, most of my patients now I have a, fairly distorted lens of patients because, the ones that come to me are very sick and they've been
Yes.
sick for a long time. And I just forgot what the question was. How does the gut and nervous system regulation? So this alludes to what you were talking to earlier, but I definitely find there's a couple things around the trauma and the nervous system where if the exposure, so the Lyme or the mold exposure or whatever happens during a traumatic period of your life, it tends to get in deeper into the nervous system and it's harder to treat if we don't work on the trauma and resetting the nervous system. And then being chronically ill with a disease or an illness that Western medicine doesn't recognize that you could go to 20 or 40 doctors for and they can't figure it out and you're in pain and that is traumatic, like
Sure.
being told 20 times there's nothing wrong with you and you can't go to work and you are a really functioning, high functioning human with a happy life and they've got medical trauma. And so it needs to come in at some point for almost all my patients. Now, if it's a recent thing and they go through it all quick, they may not need it. But it comes in earlier if a patient has a paradoxical or adverse reaction to almost everything you give them. So if they're really sensitive and they just react to everything, a lot of times you have to bring in the nervous system resetting earlier, or you just won't get anywhere because the body has to feel safe for it to heal. And
Yes.
understandably, they don't feel safe in their bodies. I mean, a lot of them
Yes.
dissociate
Yeah.
because it's so uncomfortable in their bodies. And so yeah, that's a big, part of it for most of us.
Yeah, and I mean, if the nervous system is too dysregulated, that's going to impact motility and your ability to detox, your ability to clear out toxins and waste can be hindered by that nervous
Yeah.
system. So it all kind of needs to work together to get that person to heal.
Yeah, exactly. And then you were also talking about gut dysfunction. So, like, we could look at it from a bunch of different ways, but in Lyme disease, so I really believe that there is generally a reason why the Lyme is still active and replicating and chronic in somebody's system.
Right.
Not always, but and I'm sure there's a lot of things we don't know about yet and genetics and all that. But so the top five things that I use or I treat in a chronic Lyme patient is it's always mold if there's mold there first. And I actually won't treat someone for Lyme without doing a mold test. And if it's
Interesting.
negative, but they have a known mold exposure, I will still do a mold protocol before I start on Lyme. Because if I start on Lyme and there's mold in the system, they'll herx and we'll never get off that road. Like we'll just be doing this forever. And so mold and then yeast overgrowth, parasites, and then gut dysfunction. So your immune system lives in your gut, 70% of it. So if you've got dysbiosis or other overgrowth or celiac and you didn't know, or something like that, your immune system is not going to function optimally to fight these bugs. And so the gut has to get healed, and then big toxin load, so environmental toxins, heavy metals, that kind of thing.
Yeah.
And so I usually go through all of those things, healing
Yeah.
the terrain, and almost always they get 100% better before we're done. And I don't actually have to directly kill Lyme bugs. Now, sometimes I do. And then I'll usually start with herbs. If I've done all that homework on the terrain and they're still symptomatic, I'll start with herbs. And I sometimes use low dose immunotherapy. And if I need to, I use antibiotics. But
So,
usually, once
so
you've done all
where,
that work, you don't
mhm.
need the antibiotics that long. And you don't need like five of them. You need like two of them.
So to kind of this is an interesting theory. Personally, I've thought of Lyme as being more intrusive on the body than mold, and it sounds like we kind of have you see it in yeah.
Yeah.
This is an extremely interesting point that I want
Way
to
of
cover.
looking
So
at it.
obviously, I'm still in my way of wrapping my head around all these stealth infections to to be honest, I looked at Lyme as kind of this aggressive detriment that was more impactful than even mold may be. And I looked at it in the sense that the Lyme was hindering recovery from everything else. It
Mm.
almost sounds like you take a different approach where mold is the big detriment, and that prevents anything else from healing. So I have it a little bit backwards in what you've seen.
Although I will agree with you that the invasiveness and destruction of Lyme is probably often worse than mold, but mold is the reason why that it's
Very
still
interesting.
going and active.
Yeah. Very interesting. So what you've seen anecdotally through your treatments is that you don't necessarily need to directly always treat Lyme. The immune system and nervous system can handle this if the other detriments are taken care of, such as mold toxicity, heavy metal toxicity, etc.
Often, yes.
Wow.
And the other thing is when a Lyme patient gets better, if you can do all the cleanup and all those other things, it's unlikely to ever come back to bite them.
Yeah.
Yeah.
What does treatment timelines? I know this is very different person to person, but rough idea of what your typical treatment timelines look like for specifically mold if they don't have Lyme.
Yeah. So this is my least favorite question.
I know.
I'm sure you know that. So there's a lot of variables. So I'll speak to the mold timeline, but if you're no longer being exposed, um, it's probably 3 to 6 months minimum.
Yep.
Might be longer. I will go until the mold is negative. Now, when I say that, but patients panic because they think, oh my God, I'm going to be this sick for another year. And that's not how it works. Like you start getting better after 2 weeks. I do mold treatment in two phases. So phase one is like bind and unwind, get the body practiced at detoxing mycotoxins. And then we layer in phase two, kill or be killed, which is antifungals and biofilm. And so, if you're no longer being exposed, some people on phase one in just 2 weeks begin feeling better. And then the vast majority of people have a big, huge clinical turnaround. The needle moves when we start phase two. So, it's not that you're going to feel this horrible for a year. It's just like we might not be completely done for, 6 months to a year, but you'll
Yeah.
start feeling a lot better quicker. I mean, every time, we meet, they're significantly better.
Absolutely. Yeah, no, I explain the same thing to people that, you know, we're unpacking sometimes decades of dysfunction into a couple months, 10 years per month reversing dysfunction. This is essentially a crash course into getting healthy. So 6 months really isn't that bad when you've had Lyme and mycotoxins for 20 years. And a lot of that is just allowing your nervous system to calm down, allowing the immune system to come back into par, hormones to come back. And that's where everyone starts actually feeling good. So to your point, when you give that timeline, you're talking about truly remediated and healthy by the end, not just feeling better.
Yeah, and in a way that it's not going to come back to bite you and you're never going to get that sick again. So,
Right.
mold treatment or mold illness is depleting. So, we use up all of our antioxidants to help detoxify mold and mycotoxins. So, glutathione, alpha lipoic acid, vitamin C. And then we treat them with binders for, gosh knows how long. And that is all also depleting. And so, when
Yeah.
we're done and they're better, we do mitochondrial resuscitation and, refeed all the mitochondria and everything. So then,
There's so many details or context to what we consider healing that it's more than just your symptoms feel better.
yeah. And you know what's really fun is when people, like, so I do scales sometimes just to try to track because people don't notice the absence of symptoms so much as they notice the symptoms, So if you're tracking them
Yeah.
and you're like, well, any migraines? They're like, oh my God, I haven't had a migraine in a month. That's the longest I've ever,
Yeah.
but they didn't notice.
Yeah, they didn't think about it.
Mhm. Yeah. And so I'll use, scales like of 1 to 10 of energy level, 10 being optimum or different things just to try to track the pace. And
Absolutely.
and what often happens is as they get better and better and better, they start like their goals get higher. So they
Good.
start going, well, I know I said I was a 7 back then, but I'm gonna say I'm a 7 now, even though I'm way better than I was then, because I want to get to
Yes.
9.
Yeah,
And they
absolutely.
start seeing the possibility of like, feeling better than they ever have.
Yeah, absolutely.
Yeah.
Let's talk about blood markers that you commonly see with this type of dysfunction, and coinciding that with some symptoms. You brought up earlier on, I hear this often that when they talk about the people who are truly symptomatic of chronic Lyme or mold toxicity, they put out these very low numbers, but then I always think to myself, but our society has a 60% disease rate. So realistically speaking, how much of that is undiagnosed self-infections? I look at the people who truly benefit from GLP-1s, and it's like, you guys have Lyme. Like, you guys have mycotoxins. That's why your insulin is 25. That's why your CRP is a 7. Like this, you know what I mean? Am I
Yeah.
off base from what you
No,
see?
totally agree. Yep. And I think the anti-inflammatory effects of the GLP-1 make them feel a lot better.
Yeah,
And
yeah.
they all have tons of weight gain and like they don't eat anything barely because they've got MCAS and
Right.
yeah, yeah, I see that quite a bit.
Yeah, so I mean, are there so when people first come to you, do you have your standardized testing, or are you focused more on symptoms and just what you can kind of be confident in, or do you take them through standardized testing first to directly clinically diagnose? Talk to us a little bit about testing requirements
Yeah.
for you.
Yeah, so I do an extensive intake. It's 2 hours, and after doing this for so long, you get a sense, and sometimes I'm wrong, but usually
Yeah.
I get a sense of, okay, there's mold and there's this and there's
Yeah.
um, and so I do an extensive intake that helps dictate what testing I'm going to do. And then I always do a really comprehensive blood draw in the beginning it throws a wide net and can help us give us like clues as to where to, test more, where to spend our money and time and energy.
Yeah.
Then I don't know if this is as common, but I really focus on in the beginning strengthening the system. So, because by the time they get to me, they're so, chronically ill and they might be sensitive. And if all their hormones are tanked and they're not sleeping, they just don't really tolerate treatment very well. And
Sure.
so I do a lot in the very beginning until we've got all the rest of the diagnostics back of like building up the system. So, that's, bioidentical hormones. If they're low, get them on progesterone, testosterone, whatever's low, up all their nutrient levels that are low, especially like their methylated Bs and all that you need to detox as well. And I try to always get them sleeping because I just find nothing gets better if they're not sleeping. The
Yeah.
physiology falls apart and you can't determine what's true fatigue, what's sleep deprivation, what's making the anxiety worse, and the brain fog. And, so I do a lot of kind of just building the system up to be strong. And sometimes patients are like, well, but if the reason I have no testosterone is a mold, then won't it just, and I'm like, it will, but it might take a year or two. And you might
Yeah.
feel you've got all this post-exertional symptoms that you might be able to exert and have a more
Yeah.
healthy, vibrant, strong system, with which to go through all this with. And so I do start with that. And then
Mm.
I start right away with mold if it's a big suspicion. I do a mold test. I do a urinary mycotoxin.
Got like
And
Vibrant Wellness, or do you have a preferred
yeah, I
brand?
do. I love real time, probably because it's been around the longest and I've used it the longest and I trust it. It's so, in my opinion, it's very specific. You're not going to get a lot of false positives. You're not going to get the false positives from foods and things that you might get in some other testing.
Right.
It's not as sensitive, so you can miss some. And so I think it really needs a big provocation. So I do an IV of phosphatidylcholine and glutathione and
I
then
was going to ask about that. Yeah.
collect the urine after. And then if they can't do the IV provocation, I like Vibrant. I trust Vibrant's mycotoxin. Not necessarily every test they do, but I do trust their mycotoxin.
How do you feel about their tick-borne disease testing?
I'm not sure yet. Yeah, I just will say I'm not sure. Have you seen a lot of the panels?
I have. Yeah.
I mean, it's like everything's positive.
I definitely, yeah. I mean, there's definitely antibodies on. I have seen two tests that came back completely zero.
Well, it's cool.
Yeah. So it is possible. Uh,
Hmm.
but to your point, everybody has antibodies. I will argue though, all of those
It's
people have
true.
muscle skeletal symptoms, GI symptoms, endocrine symptoms. So is the test too sensitive, or do that many people just have Lyme? That's the
It's
question.
true. And I guess, I
Yeah.
mean, it's just that there's so many other
Yes.
infections and, things that I feel, I guess, yeah, I need to just look into it more and see if
Yeah.
I, do trust it.
Yeah.
But people get really like I get patients from other clinicians and stuff they're obsessed with the HHV6 or the toxoplasma or something that is definitely not root cause here. Like,
Totally.
just don't even, they're like, but I've got all these other, those will go away. Just
Right.
focus on the important root cause things. And maybe that's why I have kind of a funny feeling in my system about it. Yeah. I probably
I
didn't
hear you. I mean,
look into
I
it
run
more.
into that very similar situation with patients who come to us for GI issues. I
Right.
have a woman who is so confident she has chronic Lyme, but all she's fixated on is this idea that she has an ulcer. And it's like, well, but something's causing that ulcer, and we
Right.
already know that you have GI dysregulation and stuff. So I'm trying to get to the root, and she just keeps fixating on the symptom, and we just go back and forth over and over again, you know?
Yeah, yeah, yeah. So for Lyme, I love Igenics. They've been around the longest, and
Yeah.
yeah, I adore the family that created Igenics.
Oh, that's
They
cool.
like the fathers of Lyme and chronic
Yeah.
Lyme. But yeah, I mean, I totally trust Igenics. It's expensive. And, I agree with the woman that you just interviewed about Lyme, in
Yeah.
that, you can figure out a lot of it just with your intake. And I disagree a little bit in the sense of like, if I'm strongly suspicious and I'm going to go down the Lyme road and maybe we've already done mold and they're still symptomatic. And so for sometimes it is hard to get people to go down this really complex road of like opening
Yes.
Pandora's box after Pandora's box, and now we're
Yes.
treating that thing and now we're treating this thing if
Yes.
they're not even really sure that Lyme is there,
Right.
and how could I be 100% sure? But and you can do, I do that provocation she talked about too, just for diagnostics sometimes. Like, so if I'm sure and they say no way, and I do a test and it's in between, it's like indeterminate, suspicious, but not positive, I'll do that exact same thing. I give them a L complex for 3 days, and if they've got Lyme, they will throw it out the window and they will never argue with you again. It's like,
Yeah.
and if
Let
nothing
me ask you
happens, we let it
something.
go.
Do you ever do any type of provocation test prior to, or strategies prior to Lyme testing?
I don't that often. It's
No.
probably smart, but you do, if you're not there to the treating it yet, you're probably definitely gonna hurt some more, but
Yeah.
it's not a bad idea.
Let me ask you this. With any type of provocation test, my only concern was, can this skew a false positive?
You
Could this
mean
create
taking
a,
herbs?
yeah, like some, if you throw in some antimicrobials prior to doing the mycotoxin test or a Lyme test, um, would it possibly show a positive that wouldn't have shown before and create a
Mm,
false positive, or is that not possible?
No, I don't think so. I mean, the things that we give for provocation for Lyme, they're herbs. It's like, Siberian ginseng and things
Yeah.
that if you
Cat's
don't have
paw.
Lyme, they're plants. They're gonna feel fine. But
Not so
oh,
much
I'm sorry.
in
You were
the,
asking if it changes the test.
yeah,
No,
not risk of
there's
symptoms,
any
but
way
can
that
we risk
herbs
the
could
test?
change an antibody test, right? Or a PCR? I
Right.
don't think. And then for the mycotoxin provocation, it's so phosphatidylcholine and glutathione help you detox and pull out mycotoxins, but it's not going to create mycotoxins in the body that aren't there on a
Would it
result.
would it
Now,
lessen the levels though?
will it what?
Would it lessen the levels and maybe
It
make it
would
look less
increase them.
severe?
It would increase them.
Oh, okay. Because it's more
Yeah.
present in the bloodstream, basically.
So mold is in a lot of different places. The phosphatidylcholine helps pull it out of the fat soluble toxins that have, accumulated for a lifetime. And the glutathione helps detoxify, metabolize mold and mycotoxins so you can get it out in the urine, the stool, and the sweat. And basically, the
So you're
people,
drawing it into the urine before taking
yes,
the urine test.
yes.
Got it.
Yeah, and so another way of looking at it is the people that get sick from mold are the ones that don't detox it. They can't metabolize it.
Yes.
They're unable to break it down and get it out in the urine, the stool, and the sweat, and that's why it has built up and that filled their bucket and why they end up in my office. So people that detoxify mold fine don't get sick from it.
Yeah, yeah. And
Yeah,
that's why two people could live in the same house,
yeah,
and one person's like, "No, you're crazy. The house is fine." The other
yeah.
person's suffering from MCAS like every day.
It's tricky because if it's like one person, how could it possibly be the house? And yeah, it is. It was, we used to always say a quarter of the population is sensitive, but I really think that's increasing.
Yeah. Well, and it's hard to pay attention to any of that data knowing how many things get missed by conventional medicine. So what are we using to make these claims about percentages of society if we already know that they're not diagnosing these things properly?
It's so true. I wanted
Yeah,
to tell you how you were saying how who knows how much is Lyme because they're not. So I used to run like LabCorp Western blots for Lyme all the time, back when I first started doing Lyme and stuff. And I think I probably got over 15 positive Western blots in LabCorp, which is, that's just because I ran so many. And
yeah.
the nurse from the public health department would call me and she would go, so we see you have a positive, Western blot for Lyme. Can you tell me where the patient has been in the last year? And I'll say, well, they haven't traveled at all in the last year. And she'll say, well, that's not really possible because we don't have Lyme in Colorado. And I'll say, it absolutely is. So can you just
Yeah.
put that down as patient number one? And she'll go, no, 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 no. She couldn't have gotten it here. And I got this phone call like 6 times. I was like,
Ah,
I mean, I've given you 15 cases, you should be counting. So like quit
yeah,
denying. What's the denial about? It's so
right.
it's so weird. Why?
Yeah, it's very interesting. It's interesting the lack of discussion around Lyme and stealth infections as a whole.
Curiosity, but like
Yeah,
what you I mean, do you feel good about all those chronically sick patients? You said I don't know and I can't help. Like,
right.
isn't there some curiosity?
I think when the curiosity takes away their bank accounts, that isn't helpful to them, you know? That's the big pharma stronghold over our system, I think, unfortunately.
Right, and that's the reason why that it doesn't have big research,
Right.
studies and stuff. I mean, the maker of doxycycline could fund a huge,
Yeah.
research
Yeah.
study. But a lot of
You're
these
so
things,
right.
we treat with herbs and stuff, and you can't patent that kind of thing. So.
Yeah. Yeah. We talked briefly about various symptoms that they can see. And you did bring up, supporting endocrine systems and whatnot. So, in your practice, just to kind of confirm for our audience, stealth infections, whether we're talking Lyme, mold, or both, very commonly do lead to endocrine dysregulation, whether that's anovulatory cycles, PCOS, endometriosis, ED for men, and low testosterone for men, not just women. You're seeing quite a bit of that, correct? Yeah,
I say
yeah,
all my patients have like
all of
no
them.
hormones, no thyroid.
Yes,
Yeah,
yes, thyroid too. Yeah,
mold and Lyme are both endocrine disruptors. And so yeah, they mess with your immune system. And then, you can also look at it from the adrenal perspective where your adrenals are shot. You've been trying to go to work and make dinner and do all the things you have to do, and you're sick and you've got no energy. And so your
yeah,
adrenals kick in more cortisol for you, which is that, kind of wired tired, but I can still do it. But it doesn't
yeah,
really feel like good natural energy. And
yeah.
then eventually your adrenals won't compensate for a lack of natural energy and they'll tank. And then they take all your other hormones with them. So
Sure do.
testosterone and cortisol convert directly to each other. Progesterone and cortisol convert directly to each other. And so, we see those just tanked in every chronic, illness patient that we've got. Yeah.
And obviously, because of that, the intricate differences between male and female physiology and that adrenal aspect, do you tend to see quite a few more women suffer from these dysfunctions than men, or would you say it's pretty even between both genders?
That's a great question. I feel like the numbers I see or I hear about is more women.
Okay.
And I probably have slightly more women, but I wouldn't say it's a huge, like
Shift.
it's not 80% women and 20% men. It's, maybe
Interesting.
60, 40 or something.
Yeah. I
Yeah.
think a part of that too is and you may not experience this the same way, but I feel like men are just less likely to
To come in.
address symptoms and go to the
Yeah.
doctor and stuff like that. So they could have a little asthma and psoriasis and be like, "Pff,
And
I'm
totally blow it off. Which
yeah,
is maybe where I'm seeing more men because they don't come to me until the system is completely tanked. They can't exercise anymore. They can't do their
yeah,
work. They can barely work, and their whole
yeah."
livelihood is falling apart. And then they come.
Then they finally come. Yeah. Yeah, I had this same talk with someone else the other day on this kind of same path of discussion we have of, what is the real percentage of stealth infections and the implication on disease in society? And we were talking about men specifically, and it's always the men that have the heart attack at 55 that no one anticipated and it came out of nowhere. It's like, well, it probably was something at 35 that just never got diagnosed or addressed, you know?
Yeah. Yeah, I mean, we have a lot more biomarkers and things for that now too, so that you
Totally.
get, you ideally by 50, you've had a blood draw and looked at some stuff to see if
Yeah.
you need a calcium heart scan or some further
Yeah.
work.
So do you have a course specifically about mycotoxin exposure?
I do.
Oh,
So,
amazing.
yeah, so after treating mold for about, I don't know, 13 or 14 years, I have figured out kind of what works and what doesn't. And I sort of have curated this mold eradication protocol out of, the failures and the
Best way to
great
learn.
success of 14 years. So yeah, so I have this mold eradication protocol. It's broken into two phases that I spoke about earlier. And the thing with treating mold is that there's a real specific order to it and pace to it. So I don't think it's rocket science and all that hard to do, but there's a lot of common pitfalls that people do that they end up making themselves more sick and then they think they can't get better and they kind of give up. And that's often going in the wrong order or going too much too fast. And so, after treating this all this time, I get calls from all over the world, and I can't treat people outside of my state because I'm an MD. I had a lot of people ask me to do this. So I eventually made a course. It's an online mold treatment course. And
Wonderful.
it's, 35 modules, kind of step by step, walk you through handheld full mold eradication protocol where we do,
Wow.
the whole phase one and then phase two.
Yeah.
And then we do the mitochondrial resuscitation that we talked about earlier to feed back all your mitochondria so that, everything, works better. And then I always treat yeast. So wherever there's mold, there's yeast. They're both fungal, and mold creates all the right conditions for yeast to flourish.
Yeah.
And then we do the nervous system resetting, which can come in the beginning if it needs to, or towards the end. So the way that I try to describe it, after they're better, for the nervous system retraining is that what can happen is that you're better and you go into a moldy building like a movie theater or something and some of your symptoms come back, some weird neuropathy or something, and then you understandably panic and your nervous system panics and your limbic system panics and the whole like, oh my God, am I going to get that sick again?
Yeah.
That whole response increases the inflammatory response of the mold itself.
Sure.
And so it's not yet that you're making it up in your head, but your head is making it worse. And
Mhm.
so often, if I can detach the emotional panic response, just emotional response at all from the physical sensation,
Yeah.
then the physical sensations sort of go away with time, and we
Yeah.
work a lot on tolerance and resiliency.
Yeah.
And part of that is just that believing you're going to be okay and that you'll never get that sick again, and trusting your body and all of that. And then part of that is also just lowering that total body burden in your bucket enough that you've got room to get some glyphosate in your whatever you're eating or whatever it is.
Yeah. Well,
Yeah.
and I think too that, I was going to say, so oftentimes, you're kind of discussing like the internal programming or thinking pattern of the body, but even just from a psychological aspect, someone isn't going to truly be confident that they're better unless they go through the time of not being reactive. So, like after a healing protocol, they're kind of still thinking, I'm on thin ice. I'm just waiting for it to come back. And then over weeks, months, years, that's when they gain the confidence of like, okay, it's not coming back. I am healed. Hopefully, it doesn't take years, but probably months. And I wanted to bring up too that, it sounds like I do very similar phases. And so I just want to touch on kind of what I do and hear your thoughts. So with a lot of these treatments, I always feel like working on detoxification support kind of comes in first, and even some digestive support if we feel that that's hindered, because that goes with detoxification. From there, my phase two or second step is immune support, inflammation support, then going into eradication, biofilms, antimicrobials, and then that final phase, repopulation, repair, and just continued support as they heal. Is that kind of tracking similarly?
Yeah, 100%. So the
Yeah.
whole like, the whole phase one is sort of what you just described as the supporting all your detoxification pathways, your liver, lymphatic pathways, making sure you're having daily complete movements. We start, binding in that phase. And the way I describe it is it's like you're sort of teaching the body how to detoxify, metabolize, and get them out in the urine, the stool, and the sweat.
Yeah.
And so that has to be sort of like practiced for a while before you can go into the next phase.
Yeah.
But yeah, exactly.
It's a really well way of putting it. Thank you for that.
Yeah, sure.
I've always kind of hummed a similar line that, functional medicine, we're trying to just support the body in doing what it's supposed to do anyways. And that's kind of what you just referenced with if we just give the body a nudge in the right direction of like, hey, this is how you detox, it can then pick it up from there and continue that pathway.
100%. And the truth is these toxins are toxic to all of your cells. They don't want them there. As soon
Yeah,
as they
sure.
see a way out, they'll start dumping, and that's the die off that you get. If they dump more than you
Yeah.
can get out, then you got to back off a little bit. But
Yeah.
yeah, your body doesn't want them there. Your body wants to be healthy. And then I always tell people you're never going to get this sick again because
Yeah.
you know what to do now. You know what the signs are. Your body has done this. It's practiced it. Like you'll be able to do it 10 times quicker. You've got me, you've got the remediator you've met, like it's never going to be that, there's always little regressions,
Of
but as
course.
long as we're still on the path upward, then we're good.
Yeah.
Yeah.
Do you ever tend to leverage specific, outside of HRT, do you tend to leverage specific peptides or medications like LDN, methylene blue, anything like that in your treatments?
I use all of it. I try to be targeted, so for example, if I'm doing a mold protocol with someone, it's a fairly complicated protocol.
Sure.
Like I said, it's a great diagnosis. People get better, da, 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 but it's a complicated thing for them to do. And then I'm generally, I've already started them on, maybe some thyroid and some progesterone and some sleep support and made them start methylated Bs. And so I try to keep it sort of targeted so it doesn't get overwhelming and they're not taking 500 things. And then,
Right.
we go into the next phase of treatment and that we can add things in. But if there's an overwhelming symptom that I think I could handle with methylene blue or something, and they're up for adding that in as well, I'll add it in at any point.
Yeah. Yeah,
Yeah.
I think I mean you brought up great points because people will ask all the time, well, what about this or what about that? Well, it's like, well, trust me, you're already about to invest a lot of money in this treatment. So let's
Exactly.
hold off on adding something else. If you
Exactly.
really want to add it in a couple weeks, we can talk about it again.
Yeah, they come in and they're like, well, what about doing 20 peptides and IV stem cells and HBOT? And
Sure.
I'm like, give the protocol a minute. Like, and
Yeah.
then, we'll add in the other things as needed. But
Yeah.
yeah, I mean, you're gonna spend your whole wad in the first,
Yeah,
and it's a long road.
it
Not super,
is. Yeah.
but yeah.
Can you chime in a little bit about specifically some mitochondrial support that you might do on the back end? Is that
Yeah.
in terms of action items, supplemental support, a combination of items?
Yeah, so if they want, they don't have to do this, but I usually do a NutriBiow, which is a micronutrient test. It's like a 12, 14-page report. Genova Diagnostics does it. And it has your levels of vitamins, minerals, antioxidants, omega-3, 6s, 9s. There's markers for oxidative stress and heavy metals and all kinds of other things. Um, and what's happened is over the years is I can pretty much predict what the Nutravail of a mold patient looks like. So if they don't want to
Hmm.
do the test or they don't want to pay for it at that stage, then I'll just replace what's, usually missing in a mold case, which is a
Yeah.
lot of the antioxidants and B2 and, some other things like that. But yeah, so it's usually making sure they stay on glutathione. I add in some alpha lipoic acid, get some C in there if they're not on it. And then I love a lot of the NAD precursors.
Yeah. Like
So
NMN. Okay.
NMN and nicotinamide riboside and IM-NAD and all that kind of stuff.
Mhm.
And the ergothiones are kind of fun for mitochondrial function. I mean, it gets fun at that point because there's things you need to replete, but then there's things that you can play with that are good for mitochondria that you can see what makes you feel better and what gives you more mental clarity and
Yeah.
more energy, and then, stick with those.
Mhm. That's super interesting. Um, going back to the mycotoxin course, do you happen to offer any other courses?
No, this is my first one. It's an online course. You can do it two different ways. You can do it yourself and just go at your own pace, or you can do it with twice a month Q&As with me
Very cool.
for more money. So
Yeah, that's awesome. Do you
yeah,
and or have you considered doing any other courses in the future?
I don't know. We'll see how this one goes.
Is this pretty new?
Well, I launched it last summer and I did a live consortium. So I did a live one for I don't know, 10 weeks or something. And that went great. People did really, really well. And that was really nice to see that it could work in that kind of a format without me seeing them each one-on-one.
Yeah,
And then we spent like since, I don't know, the last 8 months kind of editing and redoing and polishing up and stuff. And we've just relaunched it recently.
very cool. That's awesome.
Yeah.
Um, Well, I know we're getting close to our designated time, which I think this is a perfect time to kind of wrap things up. Dr. Fox, will you please give everyone insight on where they can find out about your course, but also where they can just find out more about you, follow you, connect with you. If they need to, God forbid, they need treatments, how do they get a hold of you? Give us all the details.
Yeah, sure. So my clinic is Boulder Holistic, and that's boulderholistic.com. And then
Okay.
the course is drfoxmedicaldetective.com.
Yeah.
So there's like a free webinar on the course and mold treatment on there and a lot of other information. And if you sign up for you can sign up for either newsletter. One will be a lot of functional medicine, biotoxin illness from Boulder Holistic, and then the Dr. Fox Medical Detective will be a lot more mold focused. And then I do a lot of Instagram on it's Terri Fox MD, TerriFox MD is my Instagram. And I post on Facebook as well. And it's also Terri Fox MD.
Okay. Well, great. Guys, if you're listening and you're interested in learning more, please give Dr. Fox a follow. Check out her course as well, because as we can already tell from this episode, it's loaded with great information for some successful remediation treatments. I just want to thank you again, Dr. Fox, for taking the time today. This was a very informative episode. I already have my brain turning of things that I'm going to be looking into, and I'm
Fun.
definitely going to be exploring some more information from you too. So I'd love to have you on the call again and do some other deep dives. So I look forward to connecting with you again soon.
Yeah, me too. Thank you so much for having me. And
Absolutely.
thanks for the work you do in the world.
Oh, well, thank you. Thank you so much for the work you do.